So what is gynecomastia? So gynecomastia is the fat and the gland in the male chest. So the male chest looks like a female chest. So it is called the gynecomastia. So I am Dr. Vikas Gavri. I am a board certified plastic surgeon and I am very passionate for the gynecomastia surgery to make the boys happy. So gynecomastia has got three grades. So grade 1, 2, 3. So it is smaller, bigger and more bigger. So grade 1 is a challenge because the patient is already good looking. So we don't have to disfigure the chest. We have to remove very cautiously so the chest remains in the good shape, and we have to remove minor of the gland. In the grade 2, the results to achieve results is more easier for any plastic surgeon because we remove the fat, we remove the gland, and all the patients, they are very happy. And the challenge is again in the grade 3 because there is a lot of loose skin. The skin has to retract back. If the skin remains loose, the patient is not happy. If some of the gland is left, the patient is not happy. So we have to thoroughly remove the gland, all of the fat, and we have to do the skin tightening procedures, that are the advanced procedures. The skin tightening procedures are not available in all the clinics. So again, to highlight, the grade 1 is a challenge, grade 3 is a challenge, and grade 2 is easier to treat for any plastic surgeon. So what is the surgery? What is the gynecomastia surgery? So first thing to highlight is it is always done surgically. So don't go for any medical treatment, any hormonal therapy, the medical therapy, or any non-surgical radio frequency treatments. You will lose your money. So it is always surgical. The technique is called liposuction. So lipo is fat, suction is we suck out the fat. So we give a small hole which is hardly visible. We hide it in the axilla, so we take out the fat. And second surgery is the gland removal. So we give a small cut in the areola, so which is again never visible. The cut is never visible. So we remove the gland, which is the hard tissue which has to be removed. So we do both of these procedures. And the third procedure in our clinic is the body tight skin tightening. So this is again an advanced method. So even when we remove whole of the tissue and fat, your skin should not remain loose, so it should retract back nicely. So we do the skin tightening along with the liposuction on the same day. Duration of surgery is typical between 2 to 3 hours depending upon the grade, and it is always done under general anesthesia. So it is a daycare surgery. That means you are coming in the morning and you will be sent home in the same evening. So what are the follow-up visits after the gynecomastia surgery? The follow-up visit is typically after 2 days, then after 7 days. And I can see your skin is retracting back nicely. And if we do the advanced techniques as laser liposuction and the skin tightening, all my clients, they are happy in just 4 to 5 days to see their new chest. And what are the complications? This is very important to understand because there can be complications such as infection, there can be a lot of bruising, swelling, then there can be disfigurement, then there is the nipple is pulled inside, that is called the crater deformity. If your gland has been removed very vigorously, so instead of looking normal, your chest is depressed. So what you can do to avoid all these complications? So choose your doctor wisely. He or she should be a plastic surgeon, and especially experience of more than 10 to 15 years in gynecomastia surgery. You should see at least 50 cases of before and after pictures, and what technology the doctor is using is again important. I always prefer the ultrasonic or the laser liposuction. So we are lucky in Cairo Aesthetic Clinic. We have got very good infrastructure which is world class. We have the micro air liposuction, we have the ultrasonic or laser liposuction, we also have the water jet liposuction. These are the advanced techniques in the liposuction. Thank you.